Varicose veins, those dark, sometimes bulging looking veins, aren't only ugly, but can be potentially dangerous. The good thing is that they aren't that hard to get rid of thanks to one local well-trained doctor with state-of-the-art equipment. And insurance might even pick up the bill. Dr. Jeffrey Widmeyer first explains what varicose veins are and how to get rid of them.
The normal veins in your legs carry blood upward towards your heart. They have one-way valves that make sure that gravity doesn't pull blood back down towards the feet. And in someone who has valves in the veins that are not working properly, gravity pulls that blood back down and stretches out the veins down below it. So the varicose veins that we see, the bulging veins in the leg, are stretched out because they're being asked to hold more blood than they were designed to hold.
And it's very uncomfortable, isn't it?
It is. It can cause a lot of swelling, aching, discomfort.
And you actually treat a lot of folks in this area. Tell me a little bit about how long you've been here and what type of patients you tend to get through your door.
Well, I've been doing varicose vein treatment since 2000. I was actually one of the very first people in Virginia to use this endovenous laser technique. And since then, I've treated over, I think it's around 4,000 patients with this procedure. And I'm a board-certified vascular surgeon. And so my training and experience in this is extensive.
Tell me a little bit about how the procedure itself works.
Well, what used to be a vein stripping surgery, which was an operation that required being in the hospital, being under general anesthesia, has now been replaced by an office procedure that's done with just numbing medicine. Patients don't have to be put to sleep or sedated, and really just through a little needle puncture in the leg where it's numbed up first so it doesn't hurt. A small laser fiber is inserted inside the vein, and after numbing up the vein, I turn the laser on and slowly pull it back out of the vein, and the heat from that laser seals the vein shut.
Wow. That's fascinating.
Over a period of a few months, the body just dissolves that vein away.
And we actually have some images of some folks that had really serious issues, and it's amazing because the befores, look terrible. And then the afters, that's like 3 months later, right?
3 weeks.
3 weeks later.
The after pictures that you have are within 3 weeks of the procedure.
And I can imagine, standing, and it must be uncomfortable for these people to even stand with this kind of damage.
It very often is, yes.
So why do some of us get varicose veins and others don't?
I think the most real answer to that is some people just have a genetic predisposition to it. There are some people who have occupational hazards where they're on their feet a lot that tend to aggravate it. Women with pregnancy will tend to see varicose veins often occur after pregnancy, but there isn't any one cause. I have to tell patients there's not something you're doing or not doing that made this happen. If it's going to happen, it's probably just going to happen. And
the fascinating thing, too, you were telling me earlier is not necessarily much of a difference between men and women. It happens to all of us.
It can happen to men and women. Women are a little bit higher percentage than men, but we still see a lot of men.
And I have a patient here that I want to talk to, Sean. And Sean, tell us a little bit about your story, because you were really young when this all happened to you. Tell me about that.
Yes, ma'am. When I was 20 years old, I enlisted in the military. I began having vein issues when I was 20 during basic training. They continued to follow me throughout my military career when I was on active duty. And I dealt with it a lot. We're on our feet a lot. I went through an entire deployment to Iraq. Spent a lot of time on my feet, did a lot of combat patrols and things like that, and pretty much put up with the pain. I was told many times, you just tend to carry water on your legs, or that's just normal for being on your feet. And I always seemed to have an idea that there could be something different. There could be something more wrong with me that people weren't telling me.
Yeah, because basically it was really bothering you physically to stand, wasn't it?
Yes, it was. It was quite painful.
And you had kind of a terrifying diagnosis. Somebody told you that might happen to your legs in order to fix everything.
I actually had a vascular surgeon tell me that I would be a prime candidate for amputation after a few years. That I had a severe vascular issue that was going to stop blood flow to my legs ultimately over time.
Oh my gosh. And so how did you find out about Dr. Widmeyer?
My wife ended up doing some research, and she found Dr. Widmeyer online. She told me about him, and I said, well, hey, it's definitely worth another consultation, find out what's going on, and I am so happy that I did.
And so what was the process like then when you were treated?
It's extremely quick. I had a preliminary visit with him, and he talked to me and he told me, hey, you know, whatever anybody else told you, you are a classic case and it's going to be okay. And he expressed to me that it's nothing horrible, and that it's something that he can fix. And he really eased my mind with that, and it ultimately ended 8 years of pain on my part.
Wow. And did it feel better right after? Did it take weeks? How did it work?
I actually said to the receptionist in his office right after I walked out of my first surgery that the pain in my foot was gone and the pain in my leg was gone.
And Dr. Widmeyer also treats spider veins as well. He's located on Timberlake Road in Lynchburg, 434-847-LEGS or veinhealing.com.